Thank you, Mr. Speaker. I rise today to address three issues of critical importance to my constituents. The first is the urgent need to prepare for the coronavirus. Mr. Speaker, public health officials are now reporting the first presumed positive test in my home state of New Hampshire. As members of Congress, our foremost responsibility is to keep our communities safe. That is why yesterday I joined Governor Sununu and my colleagues in the New Hampshire congressional delegation to receive an update from public health officials on our state's ongoing efforts. The state of New Hampshire is currently ramping up testing capabilities, investigating potential cases, communicating with federal partners, and working with individual communities on containment and mitigation. Here in Washington, we must ensure that the emergency coronavirus spending package is responsive to the urgent needs of state and local public health officials who are on the front lines of this situation. We can only succeed in containing the virus if states like New Hampshire can depend on the full support of the federal government for costs associated with the response effort. Mr. Speaker, if there were ever a moment for a renewed spirit of bipartisanship in Congress, this is it, as our country focuses on a deadly virus outbreak. We must communicate health information clearly. We must develop effective and affordable vaccines that are made available to all who need them. And we must ensure that state and local governments, as well as medical facilities, can sustain the arduous task of containing this outbreak in the weeks and months ahead. The American people are looking to us for level-headed leadership that rises above politics, and we can't let them down. Let's pass a robust coronavirus package as soon as possible. And I continue to encourage all of my constituents to follow the CDC safety guidelines and to visit the New Hampshire Department of Health and Human Services website for updated health information.